your questions. Over to you, Mr. Premier.
Yes, good morning. It's afternoon already. Good afternoon, ladies and gentlemen, and the viewers at home. Today we would like to do an update regarding the work that we are doing in Gauteng province in implementing the measures that our national government has put in place through the national lockdown and the regulations related thereof to ensure that we curb the spread of COVID-19 across our nation. Gauteng province remains the epicenter of COVID-19 in our country, with 782 out of 1,845 cases reported to the nation as of yesterday by the Health Minister, Dr. Zweli Mkhize. This means that our province has 42% of all confirmed COVID-19 cases in South Africa. We have also lost 3 of our residents in this battle against COVID-19, and I would like to take this opportunity to convey our condolences to their families. We are deeply touched as the people of the province and the provincial government, and we wish the families healing at this difficult time as they mourn the passing of their loved ones. Now, being an epicenter of COVID-19 in our country imposes a burden of responsibility on us as a province. We have a heavy burden of responsibility on our shoulders. We must lead the fight against this invisible enemy and have to work with all sectors, leaders in various sectors of our communities, various sectors of the population in our province, to save life and contain the spread and the impact of COVID-19 on the people and the economy of our province. Consequently, the provincial government has been working in partnership with municipalities and various sectors of the population to enforce the lockdown measures, and in many areas also mitigate the negative impact of the lockdown on various, particularly the most vulnerable sections of our population. We will therefore also give you an update on how many people we have been reaching throughout the province, especially in the last 7 days, with food relief and other kinds of support. And this we have done in partnership with businesses that have generously donated, and NGOs and civil society players who have gone out there to communities to provide a number of supplies, which include food, sanitizers, and soap, and in some instances even blankets, because we are heading for winter. And we must say that as we face winter, we are also worried about what normally happens in winter. A lot of our people get cold and influenza. And in the face of COVID-19, this can be a very tough winter we are going to face. Consequently, the provincial government has undertaken tasks, and one of those tasks is that we now have 8,005 community healthcare workers who have been trained. A week ago, We said we had already trained 4,000. We have doubled the number. So we will soon reach all our community health workers. We have 9,000 community health workers. We have now trained 8,005. That is 8,005. 8,005. We also have 607 health professionals that are involved together with these community health workers in tracing contacts and in conducting screening and testing. We want to give you an update that since the 31st of March, when the President made an announcement just a day or so before, that we need to upscale screening and testing. Since that time in Gauteng, since the 31st of March, we have screened 26,841 people. Out of these people who were screened, 440 displayed symptoms and were therefore referred for testing and were indeed tested. Dr. Masuku will explain later the relationship between screening and testing and tracing. So having screened that number since the 31st of March, we also identified this intensive campaign of screening and testing. We identified where we should launch it, and we launched it in Stwetla, in Alexandra, on the 31st of March, wherein we screened 1,693 people right there in Alexandra, in Stwetla. And out of the 1,693, 201 were tested. Again, when Dr. Masuku speaks, he will explain the relationship between starting first with screening to identify symptoms and then putting people to testing. So in Stwetla, our health professionals tested 201 people, and only one person tested positive, and that person is now in quarantine. We thank the people of Stwetla for coming out on that day and for volunteering themselves for testing and for screening. It wasn't easy. Many of the people there we interacted with came to the fore and said they would love to know their status. We know that Stwetla is the area where one case of someone who tested positive interacted with a lot of people before that person left for the province of Limpopo. The community of Stwetla cooperated with us, and that we know we are going to continue to work with that community. There's since been our health professionals. They went back to Stwetla after we did the test, because we want to continue to provide medical surveillance of that area. If we find that an area may have been exposed to risk, even after testing, our health professionals will continue to provide medical surveillance to ensure that we are not surprised by any other new developments in that area. The screening and testing campaign has now been rolled all 5 districts of Gauteng. It is 2 districts and 3 metros, but using what is called the district model, we now call all of them districts. So our health professionals have gone to Johannesburg, Tshwane, Ekurhuleni, Sedibeng, and the West Rand. And in those areas, there's a specific target. They are not going to every community indiscriminately at this phase of our screening and testing campaign.
But they target high density contacts. If there's an area through the work that we have been doing of mapping where the people who are positive are and mapping where the largest number of contacts or people they came into contact with are, we map that, and the deployment of the screening and testing teams that are led by our health professionals are also directed towards the areas where there's high density of contacts. And this may be a suburb, or it may be a township or an informal settlement. But the screening teams and testing teams are also going to areas of high vulnerability. There are communities where there may not be contacts, but using a multiplicity of factors that we identify to look at vulnerability, the screening teams also go to those communities. And I must say that so far the screening teams have been to communities that are, for those who are relatively well off and for those who are poor. I know particularly in a region where the screening team went to a suburb. In terms of the regional breakdown, I also want to say that from now on, we will, on a day-to-day basis, give the breakdown of these 5 districts in Gauteng. When the numbers are coming, and we wait for the numbers from the Minister of Health, he is the only one who's got the authority to announce the numbers on a day-to-day basis. We wait for that, and once the numbers are announced, we do a breakdown region by region in our province.
So far, in terms of those cases of people who have tested positive, as of the 8th of April, and these numbers would hopefully, or normally as we do, will change this evening when the minister releases new ones. Johannesburg is the epicenter of COVID-19 in Gauteng. So if Gauteng is the epicenter of COVID-19 in the Republic, Johannesburg is the epicenter of COVID-19 in Gauteng, with 440 cases, followed by Ekurhuleni with 111 cases, Tshwane with 90 cases, West Rand with 12 cases, Sedibeng with 6 cases. Now we have an additional 123 cases that are called unallocated. I would like Dr. Masuku to explain, as a medical practitioner, what these unallocated cases are, because we have a complex of institutions in Gauteng. We've got public laboratories that do tests. We also have private laboratories that do tests. So when we do reconciliation of the and get confirmation from the NICD, the National Institute of Communicable Diseases, we look at all those, and we always able to reduce the number. On a day-to-day basis, the number of unallocated gets reduced, but Dr. Masuku will explain. So we are certain that those are people in Gauteng, but there may be a question about in which of our 5 districts they live. We also want to report that we have improved and enhanced our capacity to trace contacts using technology. And so far we have been able to trace 90% of all contacts. Now this is very important because COVID-19 spread on the basis of people who have come into contact with those who have coronavirus, and some may have symptoms and others may be asymptomatic. So being able to trace those who have come into contact with those who have tested positive is one of the key things that the world, all countries, all jurisdictions are battling with this, that the capacity to trace all the people who may have come into contact with someone who have tested positive, it's very, very important in order to cap the spread of COVID-19. So as I say, so far we are happy. We hope we will improve above 90% in tracing all contacts. As we continue to, so far we are using our own technology. There is a national process to help us deploy additional technology to be able to do medical surveillance of those who are positive and who they may have come into contact with, as a measure of ensuring that we encircle particular localities where people who may be positive may have had contact with many more people. So this is a very important area of work. We will continue to increase our capacity to track down contacts and reduce the number of contacts that we have not been able to trace until we have traced everybody. We are also we have introduced self-screening feature on the Impilo app of our Provincial Health Department. That application is very, very important. And we would urge all those who have handsets, who would really, really want to use technology to communicate with us, to use the Impilo app. Is now having a self-screening feature to ensure that there's seamlessness and easy screening by the public, including self-screening, and we will be able to get that information immediately and communicate relevantly with those that we think after self-screening need to be tested. Our tracers have been very good at using this app to monitor contacts also in many different parts of our province, working with our tracing teams who have developed an algorithm for screening, testing, and following up with various patients who are arriving at different testing sites. I also want to report on a very important matter that Gauteng province has currently been paying attention to PPE, personal protective clothing, for our healthcare workers. And as we speak now, we have adequate supply of personal protective clothing for our healthcare workers. And we emphasize that they are our priority for personal protective clothing. They are the priority, the number one priority. Of course, even other workers, including those in the security services who are working very hard, are also our priority. But we start with the healthcare workers first. We have been interacting with the trade unions in public service in Gauteng. This is a matter that the trade unions have been highlighting. We have met with them as the Gauteng Mabulo, who is the main person on behalf of our executive council, more and more personal protective equipment, and they expressed their full support for the measures that the provincial government is putting in place, including in protecting more workers. The provincial government is also continuing to do work in order to increase the number of beds, particularly for COVID-19. We are looking at lots of our existing facilities, and that work is at a very advanced stage right now. In some of our existing healthcare facilities, we are clearing certain sections of the hospitals, and in other instances, to another hospital, so that that hospital
We are also working with the private sector. We are identifying additional beds as we speak. Our team is at a stage of finalizing this to know how many additional beds we will get from the private sector for all different purposes. Some of the beds are for hospitalization, high care, and ICU. Others are also for quarantine. The quarantine beds will not be in our hospitals. We are working with our municipalities. We have identified various facilities across Gauteng where, should we have more people, especially in communities, high density communities, should we have more people
quarantined, taken out of their communities for a specified period in accordance with the advice of our medical specialists. It's usually 14 days. We know now how many beds we have in Ekurhuleni, in Johannesburg, in Tshwane, in Sedibeng, and in the West Rand. This is work in progress. Some facilities, especially for hospitalization, some facilities require significant amount of conversion to repurpose them into what they would be able to do, particularly should we reach a stage where we have more cases of people who need to be hospitalized. Dr. Masuku will also give some information, share some information about how many people so far have been hospitalized in Gauteng province. This is the information we would like to continue to share, but we do not want to be sharing information around suburbs and specific townships, which information is important for our medical teams and our health professionals. We do so because we think it's enough to aggregate at the district level. We have already experienced problems of stigmatization of individuals in communities, in localities who had tested COVID positive, including those who have recovered. So we have several cases of stigmatization and we want to make sure that our healthcare professionals use their protocols to protect those who may have tested positive as they are going through the various stages of recovery. So it's very important that the information about specific localities is used for purposes of preventing COVID-19 spread and not for other things. That information is in the hands of the authorities, especially our healthcare professionals, the team that is led by the MEC for Health, Dr. Bandile Masuku, and the HOD, Professor Lukele. It's a very capable team. I am very confident as the Premier of Gauteng that the fight against COVID-19 in Gauteng is led by healthcare professionals right up to the level of the MEC for Health and the head of department and all the clinicians around them and the various category care professionals. They give us briefings, they give us advice. We are able to make decisions very evident that we are given advice by specialists and scientists to make the right political decisions. We also want to say to you that the lockdown has helped us in the following area. OR Tambo was a big area of concern for us. A lot of people who were arriving in flights from different places across the world, including countries that are at great risk, were arriving through OR Tambo. So since the lockdown, particularly including the lockdown of OR Tambo and Lanseria Airport, we have been finding that the work of our tracing teams is very focused now. There are no new numbers coming. We also want to say even the closure of the borders into our country, that has helped us a lot. Gauteng is the economic hub. OR Tambo is the aviation hub of sub-Saharan Africa. The closure of OR Tambo and the closure of the borders, the many borders across the Republic, of many of the people who come through those borders end up in Gauteng. That decision linked to the lockdown has helped us a lot. At this stage, I would like to give a briefing about the work that the provincial government has been doing with regard to providing food to the food insecure and vulnerable communities in Gauteng. I would like to start by thanking all the NGOs and the business people who have been working with us as social partners for helping us to reach, at least since the national lockdown, we have reached 15,000 households that are food insecure. Now, not 15,000 people, 15,000 households that are food insecure. This excludes the homeless people. We have reached them through the work that's being done by civil society, the NGOs, the businesses that are donating, as well as our social development department food security program. We've been together, we've been able to feed more than 60,000 people, and at this stage, excluding the homeless people. If we include the number of homeless people that we have been able to reach, put in various shelters, provide them with food and sanitizers, the number will be much more. And we are consolidating that number. The category of the homeless people is a separate category. And then we have other households, particularly in the areas of our province that are regarded as most poor or poverty-stricken areas. Those areas are Sidibeng in the south of Gauteng, West Rand, which is the western corridor of our province, and some communities in the three metros. Communities in the north of Tshwane, up to Winterveld and Hammanskraal, and communities in the far east and north of Ekurhuleni, and communities in the south of Johannesburg, and in the south and the northern areas of Johannesburg. So we've got a lot of the people who are food insecure and vulnerable in there. In the next week, we are going to increase our capacity to reach more households. Emisili Sufi is leading this effort to ensure that we can reach as many people who are food insecure in our province as possible. But we know there are many more people who are phoning, who are sending in messages, who are saying they need some kind of food relief. And we know that the situation may, as the lockdown reaches the third week, there may be more people who will be coming to the fore. I want to continue to call on business people and civil society groups, including the churches that are supporting these initiatives, and various religious denominations and organizations linked to the faith-based sector. Many of them across all religions are working very, very hard with us to make sure we provide for the needy and most vulnerable in our communities. It's also important to indicate that there are several initiatives to continue to encourage our children, the learners at home, to continue doing homework, schoolwork from home. We announced the partnerships we have with various broadcasters who are helping to bring content at home to as many of our learners as possible, using various digital platforms that we have. Just speaking on education, we are very, very concerned. We are perturbed. We are more than concerned. We are perturbed by the targeting of schools by criminals in our communities. So far, 22 schools in Gauteng have experienced either break-ins, including the 4 that have been burnt down in the northern areas of our province. We have asked the law enforcement agencies, as they do all the other work that they are doing, to set up a special team that must help us trace these criminals, heartless criminals, who are breaking into our schools and helping themselves with valuable, including the gadgets, technological gadgets that we have put in many of our schools to enhance teaching and learning. I spoke to the Provincial Commissioner of the Police, who has assured me that there is a team that is hunting down these criminal elements. In some areas, this burning down of schools is linked to people who have been disrupting projects. Some of them call themselves business forums, and we have said again and again, we work with business forums. We work with local business people who need to be supported, but criminal elements are criminal elements, and they must be dealt with as such. So the law enforcement agencies are hunting down the perpetrators of these heinous acts, and we hope there will be results very, very soon. The provincial government has also been doing work on the economy to just quantify the possible impact of COVID-19 on the Gauteng economy. We have completed that work. We have assessed all the various sectors of our economy, the major sectors of our economy that have got global, that are linked to global value chains, as well as small businesses in our townships. We have done a full assessment. We understand that the tough decisions that our national leadership had to take to carry the nation with will also impact on our economy. We also know that the downgrade that has happened recently adds to the economic woes. But as a province, which is the hub of South Africa's economy, we are also working with national government to, firstly, to help the businesses that are located in Gauteng to access some of the assistance that has been introduced by various national departments. But our big concern is on small businesses, particularly those that are located in our townships. So we are finalizing some of the concrete proposals. We will feed those concrete proposals into the national process when we have a discussion at a national level. But if there's something that provincial government would not sit back and watch as particularly the township businesses that have been doing a lot of work. Some of them, in fact, are also coming to the fore now. Many of them are saying they are able to contribute to some of the needs of this public health emergency that we are facing. And we're encouraging those businesses in the townships that are able to supply sanitizers, to supply masks, and PPE in general, to also be able to come to the fore and work with us. We are looking at additional interventions. We are talking to the SMME Fund. The SMME Fund, which was established by the CEO initiative. We are also talking to them to see how we can work together with them to direct particular forms of support, particularly to businesses that are not likely to get funding from banks and other huge initiatives. We're also working with the Department of Small Business Development in this regard. We want to continue to support the public health system in our province, including talking to the manufacturers in our province. We are an economy that has got advanced manufacturing capabilities. We have been talking to those that can manufacture more sanitizers away from what they may have been doing before, including manufacturing ventilators. In this regard, we are working also with the Department of Trade and Industry at a national level. But a lot of these businesses located in Gauteng have expressed interest in stopping what they were doing because the lockdown says you can't do that. Some of them have identified conversion of manufacturing what may be needed by the current public health emergency. I like at this point to say that we also have stepped up law enforcement across the different parts of our province. Law enforcement agencies are on the roads. They are conducting roadblocks on major roads, even on secondary roads on a day-to-day basis. When the lockdown first started, we were not happy with that work. People who are violating the regulations on a day-to-day basis are facing arrest. And we're saying to our law enforcement agencies, they should do their work. We cannot miss out expressing appreciation to millions of the people of Gauteng who have been observing the lockdown. We know there was a period during the payment of grants where too many people were crowding around the pay points and shopping malls. But we can see a lot of progress at the moment on a day-to-day basis. And we want to continue to urge our millions of our people that it's in their best interest, it's in their own interest to adhere to social distancing measures, hygiene measures, and that's why we want to reach as many people as we are able to throughout the province with the necessary supplies of sanitizers as well as soap. Lastly, we have improved significantly in providing water to various communities in Gauteng. Yesterday, when I spoke to all the mayors, we do that every week with all the mayors, we have been able to reach many different areas of Gauteng where there have been serious problems with water supply. And these water tanks we are getting from our national government, the Departments of Water and Sanitation. And I want to say we will be able to reach every community in Gauteng to provide at least through tanks, water tanks, where there's no There's no other sources of water. We will provide this working with our national government. I want to thank all the health professionals who have been doing tremendous work across our province, the security officers, our police, our traffic officers, our soldiers who have been working very well. And one thing I particularly want to say is that in the last few weeks, we haven't been seeing, few days, there's been improvement. We haven't been seeing images of abuse of the lockdown by our state security agencies. We work with them very closely. Yes, they get the message from national government, from the national ministers and the president, but they also get the message from us, our metro police, our traffic officers, our police service officers, and our soldiers are responding well. They are able to respond well to the need not to abuse the authority that they have, but to enforce the regulations fairly and firmly without abusing the powers that they have. I want to call on the people of our province to continue to help us because we are very, very far from flattening the curve. We want to join the Minister of Health, Dr. Mkhize, in restating that we shouldn't think we are over it yet. We should prepare for the worst and hope for the best. Everything we are doing, we don't want complacency. We don't want to start celebrating. We must continue to work. One of the things that worries us is beyond the lockdown. There are going to be a lot of people who are going to be coming back into Gauteng province. We are worried about that. We are already planning about that so that the management system we have put into place at the moment for screening, for testing, for tracing contacts should not be overrun at that time. So we have measures that we are already putting in place to ensure that we continue with these efforts. It's too early. We must continue to work hard because we don't know when we will reach the peak. So thank you very much for being able to give us an opportunity to do this briefing. I would like us to give particularly Dr. Masuku an opportunity to explain a few things as a medical practitioner. And we can take questions. MEC Lisufi and MEC Mazbuko will be able to answer questions that have to do with their area of work, which is tremendous work. I want to thank them for the work they have been doing as part of Team Gauteng. The entire executive has been doing tremendous work under difficult conditions from where they are to support the work of our service workers in the health services and in the security services to ensure that Gauteng province cannot slow down. We remain the epicenter and we must do more even in terms of screening. Those numbers are still too small. Even in terms of out of screening test, we will know who to test. We must do more in tracing. We don't want a backlog in tracing in this regard. Dr. Masuku, over to you. You can speak from where you are sitting.
Thank you, Premier, and good day, everyone. There are a few areas that we just need to clarify and make sure that we are on one understanding and we all understand the whole concepts together. And some of them I will re-emphasize because these are concepts that sometimes we tend to confuse. I will start with the appreciation of the support that the department and I think of health is getting from the Premier and the whole executive. It's an important support. I think as a Department of Health, we are quite grateful of everything that we've been offered and the support that we're getting from everyone. The issue of screening, it's an important aspect which we did launch last time, I think almost a week ago in Alexander, as the Premier has indicated. The aim is to increase the uptake, to increase the numbers of the citizens that are going to be screened, and why we need to do screening and testing. In ordinarily, we normally, when we talk about testing, we normally include screening in the whole process. But I think for the purpose of us explaining better is that screening is one important aspect that leads to testing, and it makes it easier for us to be able to identify a particular individual that needs to be tested. And with screening, it comes on almost 3 to 4 folds, which includes one, history. And in this regard, we are talking about history of contact or history of exposure to the person who's infected or history of exposure to the virus. That's an important aspect of the history. The second part of the screening will be about symptoms. And symptoms is the symptoms that we have been talking about: sore throat, dry cough, body pain, and sometimes a bit of diarrhea and fever. So those are symptoms that are important that we need to also to look for. And then the last part is when we actually examine you and we get a high temperature, which is a fever. It does actually symbolizes fever. So if the screening identifies you as a particular patient or person that needs to be investigated further and to be done a test, then it will take you there. We are hoping that after the approval of the rapid test kits, as we are waiting for the approval from SAPRA, it will then add into part of the screening, and which will make the screening uptake for testing quite easy and quite sensitive and specific for the people that we have to test. Currently, we have ramped up our screening. We have already done close to 26,000 actually screens. We have screened more than 26,000 people, and we have tested more than 400 people. And in that regard, we are still hoping that we have to do more. With a population of 15.2 million people in Gauteng, it means there's still a lot of actual screening that has to be done. You'd recall yesterday we're part of the team that went to visit one of the correctional service facilities here in Johannesburg. They are also part of the screening, and it's also part of identifying those who are actual high risk. So the screening and testing is also linked to areas which have got high density or high number of people who are infected and high people who are contacts who have been exposed actually to the virus. That's also how we identify where we are going to activate the mass screening that we have seen in Alexander. And particularly, we are interested in areas of high vulnerability where we know that when we get a high number of people who are infected in those areas, we might have a bit of a bigger difficulty. So even in terms of mass actual screening, we are also including the areas which are areas of high vulnerability and areas of high density, so that we are able to cover those particular areas. It's important for us to do the mass actual screening because it gives us a better sense of the prevalence of the disease in the population of South Africa. So the mass actual screening has been part of the important part of actually tracing. And tracing of contacts is one of those that we cannot even fathom us getting to a point where we we do mass screening when the known contacts have not been actually been contacted. So we need to trace the known contacts, and we need to increase. Currently, we're on 90%, and I think to make the mass screening more effective, it will be when we have covered all the known contacts, and clearly it's something that we are on our way in doing. And we had a situation in Duduza and Alex, and those clinics are clinics that had to undergo what we normally call scrubbing down, which is a process of disinfection that we normally do. It's a process that we do in some of our theaters, in our facilities, or in our wards where they've been exposed to actually an infective individual in that regard. But we also had to even say it to our metro, to our municipalities, that some of the decisions to close institutions or to close facilities, it must be a decision of the provincial command. It must not be a decision of the municipality. And hence we have developed a guideline in that regard. But disinfection is an important aspect in that regard. And with Alex is that all the contacts and Duduza, all the contacts have been traced of those health workers that have been found to be positive, and we are quite confident that we are able to maintain and contain the infection in those areas, and we are hoping to increase the aspects of the facilities actually running. The issue is that we cannot see or foresee where facilities will be closed because of the exposure, but the issue of disinfection of those facilities is an important aspect of the work that we do. We also just want to cover the issue of recoveries. You know, you would realize that there are patients that have been noted that they've recovered, but you see, the understanding becomes a bit difficult when we only use one dimension of recovery, which only relates to a patient who have tested negative after the 14-day period of the incubation or of the infection. We know that the general process of the disease, that at after 14 days, an individual who has been infected is likely to test negative, because the viral particles, they start to be shedded, and your antibodies as an individual who's infected would have overcome the infection. So that one dimension is important, that people do test negative after the 14 days, and we have seen quite a number of them. The minister has reported 45. I think with us informing him and informing the NECD, the number will be actually going up. This morning we spent the whole, one of the hospitals we visited was Kalafong. We also met the health worker who was diagnosed COVID positive 2 weeks ago. She's back at work, and she's now symptomless, and she has tested negative with her partner, and we are quite grateful that she's also willing to talk to the media and to the public about her episode of being an infected individual and how it will carry on going forward. And the issue again about it is that people who normally are infected, they will have some symptoms, and when the symptoms disappear or they disappear, it makes it easier for us to even determine that this is part of recovery. So we want to also include certain levels and certain dimensions of recovery instead of us just relying on the test itself. So even symptoms, people who improve from symptoms, when you start off having a cough and the cough disappears, or you have a sore throat and the sore throat disappears, or you had a fever disappears, also that is form part of the process leading towards full recovery or leading towards a negative test results going forward. But recoveries are there, and the other issue with recoveries is the issue of the stigma, which the Premier spoke about, that most of the individuals had actually had a problem of coming out to even talk about their status being positive because of the stigma that we have seen. We have seen an incident in one of the suburbs in the northern Johannesburg, where an individual who was COVID positive was thrown out by the landlord because of that status. There's a gated community also. They threatened and they harassed an individual that was COVID positive in their area. And it's something that worries us big time as the government, because we also don't want the stigma to be the one that rules us and even governs the community. But the community must use the facts, must also get around the issue of the myth. So in terms of recoveries, we are doing well. People are recovering and they have got improved symptoms. And we've been lucky that most of our patients who have been COVID positive have not required hospitalization. Currently, we are sitting with, in public sector, we are sitting with 2 patients who are in ICU, in hospital, and they are improving in terms of their actual status. In private, we've got 5 who are in ICU, and these are patients that, when you talk about hospitalization, these are patients that we are looking after. The majority of the patients are at home or they're in isolation wards. We are continuously creating the capacity to, like we've been reporting all along, we have successfully decanted Tshwane District Hospital to become a designated hospital for COVID in Tshwane. It has got 240 beds, and those beds are quite important for us, and we went there to view them today, and we were able to make sure that we were able to get them actually ready. Currently, they only have 1 patient there who's in ICU, the one that I've spoken about, one of those that I've spoken about, and the institution is quite ready, and it's one of those swift actions that we can, in creating internal capacity within our system. Also doing the same in Chrisani Bara and Charlotte Maxeke, and we also went to Kalafong. They've got a ward that is almost ready to be used, which is going to house close to 26 patients for isolation and for ICU. It's a ward that was renovated over the years, but we have rapidly moved in terms of activating its function. It's also one of those facilities that are actually ready for hospitalization. PPE, the Premier has spoken about it. I think here we should say, Premier, that no official or administrator of any facility must insist on our health workers about proper protection. But still in the same vein, we need to say that it's not everyone who will get the same type of protection throughout, because those who are working in the wards, interacting with confirmed positive patients, will have a different PPE. Those who are at the forefront, who are triaging, they will have a different PPE. Those who are doing screening, they will have the same, they will have also their own. So not everyone will have a similar PPE throughout. And to also add to this thing, to this issue, without following any other of the golden rules that of washing hands, sanitizing your hands, avoiding contact and so on, and even touching your face. Those are things that even if you can wear a PPE, if you don't observe those golden rules, PPE might not even work for you. But we also want to say that for the masks and others, we'd like that the public themselves must give us an opportunity as healthcare that those masks must be put aside and be used by healthcare workers. And then it's something that we need to start talking about in public, because when you can't have a situation where nurses and doctors won't be having masks, but the public, or because the public will be having more masks than our health care workers. We also have got, maybe the last issue on PPE is that the hotline that we have launched to make sure that every healthcare worker has got an opportunity to report directly to the Command Council, the Provincial Command Council, when they don't have PPE. It's up and running. And it's the one that we use so that it bypasses officials of facilities or facility managers. The number that would be publicized in our social media platforms, it's 066 494 6192. 066 494 6192. So this is a WhatsApp number that is 24 hours for our healthcare workers to use when to have to report when they are running out of PPE. And it's something that we also have moved in that regard. And we are also grateful that the stocks that we have piled up for the past 2 weeks has actually reached. We are still continuing receiving more stocks. We received a generous donation from the Motsepe Foundation during the week, who donated N95 masks to us, and they're still going to donate more of the PPE. So our preoccupation and prioritization in this fight for on the pandemic is just to make sure that our healthcare workers are protected fully and they have enough actually to protect themselves. And we are in a great sense grateful for them being there, but we must also as a public support them. And I think one way of supporting our healthcare workers is just to not use the masks in vain, and we must use it when there is a particular need. The best thing to do is just to continue with the golden rules and also avoiding overcrowded places and make sure that there is enough social distance. In that light, Premier, I think we've tried to cover most of the things that are important. The flu vaccines, those who've got medical aids, it's important that you get your flu vaccines. The ones that we have as government, we are continuously giving it to our elderly patients and also to our pregnant women and children and our healthcare workers, because we also need to actually protect them from the flu season as it is actually upon us. And it helps us to lessen the burden in our facilities and lessen the demand of healthcare if the flu is not rampant without the vaccine. And thank you.
Thank you, Premier and MECs. We'll now take questions. We'll start here. Yeah, over there. Just come here and speak through the mic, if you don't mind, please. No, the system wants to pick you up. It can only pick up from the mic.
Thank you. Nozindombi Mia from SABC TV News. I have 2 questions. The first question, how many people have been arrested in the roadblocks and that have been stepped up in this week? And for the health MEC, you touched on the issue about Alex, but we understand that there is a healthcare worker at the Masakani clinic who tested positive. What measures were put in place to ensure the safety of staff and patients in Alex? If you could give clarity on that. Thank you.
All right. Are there any more questions? Okay, nothing. Let me just check. We did receive a few through the WhatsApp system. Good. Okay, I think, yeah, just a few questions. One from Network 24, Christian Duplessis. How many infected patients are being treated at state hospitals, private hospitals? And I think Dr. Masuku has answered those. How many of the infected patients are in a critical condition? How many tests have been carried out in communities? That has also been provided for in the statement. How many people have tested positive in communities? How many people have tested negative in communities? And then another question from Rapport. How many people have been tested in Gauteng so far? I think it's a similar question. Secondly, what will the province's input be if asked for a possible extension? I think let's leave that to the authorities that are dealing with that. Then another question from Eyewitness News. Where is the epicenter? We did say that in the statement. What are the test results from Alex? Again, that has been provided. When will the informal settlements are the informal settlements being moved? Target numbers of tests per day in the province, and how many people have done tests in the province? I think we've dealt with that one also. Is it too early to suggest an ending of lockdown? Again, that I'm sure will be dealt with by the President and the National Command Council. There's another question from Nikele, which basically talks about a number of people who are still not adhering to the lockdown regulations. I'm sure the MECs or the Premier can comment on that. Those were the questions. The technicians have requested that we speak from the lectern, Premier, so the MECs can proceed to answer.
Thank you very much for the questions. Mine, I think it's only one. I'm not sure if Premier will respond to it. On the number of people that have been arrested, as the province, it's only national that releases the statistics, so we don't release the numbers after they've been audited. But I must indicate that various people have been arrested for various offenses, such as your illegal trading of alcohol, general non-compliance with lockdown, and taxi drivers that have overloaded and not complying to the 70% that was outlined by the minister. And the ongoing Okaimolao operations are also ongoing. Even this morning, their statistics were actually released of people that have been arrested for various offenses, including gender-based violence, and other people that do all the wrong things. Those that have been arrested at roadblocks, sometimes others, they seem not to understand that when you get to a roadblock, what it is that we are supposed to produce. Others are not carrying their correct permits. Those that want to cross into other provinces, either going for a funeral or going for other emergencies, they have to produce those documents or the permit that indicates that. Other than that, they then get sent back, and those that refuse to comply, they then get arrested in line with the Disaster Management Act. So the police stations almost alongside our various borders like Heidelberg, Vereeniging, Davidton, Twatwa, those are the ones that so far, some of those that have been arrested are actually kept. Thank you very much. There's been a lot of burglaries in our schools. I must indicate that from yesterday, after various investigations were done on the burning of schools in Soshangove, 2 people have been arrested for questioning. There's been burglaries in clinics. I'm not sure what bafuna clinic or bafuna mapilisi. We don't know what it is they're looking for. But those burglaries also, the police are investigating. And as and when more and more information we get, we'll be able to share with you of all those people that have been arrested. And remember, because they can't go to court because courts are non-functional for now, but I'm 100% sure we'll be able to share with you who and where are some of those people that have been arrested. Thank you, Siabo.
Thank you for the questions. I think most of them had been covered on the statement, particularly in terms of the number of tests that have been done since we started, we started calculating and making our tracking of the numbers from the 7th, and I think we moved from 6,000 on the 7th to 26 over a day of period. So we are certain that we are going to do a number of tests over 100,000 over this period of this weekend. And I think the issue of the community testing, it becomes important, like I've said, that we in a real sense need to determine the prevalence of infection, particularly in areas which of high vulnerability and high density. And we did indicate that the epicenter in Gauteng is Johannesburg. It has got a high number of infected individuals, and we also have been able to trace and track all the contacts of those individuals, and we are quite close to making sure that we are on 900% for the tracing. And the informal settlements are a big concern, and hence we do have a number of satellite testing sites in the informal settlements. And I think one thing that is important that one needs to mention is that the lockdown has helped us a lot just to reduce the rate of transmission. Just the closure of borders itself, the border of the OR Tambo, the port of entry in OR Tambo, the borders within the province has helped us in a great deal to reduce the rate. Hence, we saw some form of a plateau last week, but now because of the community testing that we're doing, we are starting to see that we might get another spike of the rate. And we are hoping that in determining whether the lockdown should be extended or it should be ended in the coming week, it will all be about how successful we have been in terms of community testing. In Gauteng, for 15.2 million people, we are expecting at least to cover a bit of the 20 or so, 20 to 30% of the community. But we are focusing more on areas of high vulnerability, a high number of contacts, and high number of infected individuals, so that we don't just do it randomly, but we also get focus on areas where, in a real sense, we need to get the sense of the prevalence. And maybe the last point would be, or two last points, the point on Alexander, yes, it's confirmed. It was one staff worker, health worker, who worked there. And I'm certain that we all understand that the person who works in the clinic is a health worker, whether they're a cleaner or a gardener or anything. So a person who's employed for us, it's one person that has been found to be positive, and we have been able to trace all her contacts, and all of them some of them, they are in quarantine awaiting their results, and some of them have been cleared. So we also went there, had a very lengthy discussion with the labor, and labor was also quite comfortable with the scrubbing down and the disinfection of the clinic, because we wanted the clinic to continue functioning, but undergoing that process of disinfection and also making sure we are able to get all the contacts traced. We have been on the fortunate side of things in terms of the patients that require hospitalization. At the current moment, I did mention that we've got 2 in public sector, and we've got 5 in private sector. And maybe just to mention that the deaths that we have recorded in Gauteng, 2 of them have occurred in private, and 1 has occurred in public. And with the death, the important thing that we also want to mention is that most of them had comorbidities, comorbidities, meaning that they had an underlying actually disease, like your hypertension, diabetes. The other one had cancer. The other one was just an elderly person who actually succumbed to the disease. We are hoping that with all the measures that we are putting as a call, that maybe the Premier will have to re-emphasize that we want the regulations to be fully enforced during this period, and it will give us a good time to catch up with our screening and testing, and we're hoping that we'll be able to get a better outcome from that. Thank you.
Thank you so much, Premier, colleagues. I think let's start with the homeless. We just want to thank all the municipalities that worked with us to ensure that we accommodate all the homeless people within our province, in particular the municipality of Tshwane. I want to confirm to Honorable Premier, we now have government in Tshwane. The work that that municipality has provided, it's truly, truly appreciated, and want to thank them. We also want to thank the NGOs that are currently accommodating additional people, and we also want to thank our social partners that provided all the relevant food that was needed so that we can give to the people of our province. The Premier went through the details of the food that we've allocated. We continue to allocate that food at an average of almost 2,000 per day, that we make allocations across the entire province for those that need assistance. Our email still works, so anyone that feels that there's somebody that is in need and that we have not managed to reach that particular individual, you can just send an email at support@gauteng.gov.za. That's support@gauteng.gov.za. Within 48 hours, we then do the screening, and if the person qualifies, we utilize our regional food banks to distribute food to that community. I also want to touch on the education aspect, that indeed we are accelerating our work through online education and also in providing lesson plans to families that can assist in ensuring that their children are given the necessary support. Our commitment is clear. No one will be disadvantaged because of the coronavirus that we find ourselves in. Our commitment is that when the schools are reopened, when the President announced the date in which the schools will be reopened, we'll ensure that we provide all support to all learners, so that there must be no advantage of those that have, or those that have access to online to say, we don't want a repeat class because we know the lesson. We want all our children to be treated the same and be given the necessary support. Through the Ministry of Basic Education, we've been coordinating and exchanging resources amongst ourselves in the country so that no province is left behind. So our commitment still stands. We want to appreciate and thank law enforcement agencies, in particular the SAPS and the community safety led by our MEC here, for apprehending 2 suspects that we really believe that are, might give us information that will assist us to know why people are burning our schools in Soshanguve. So those 2 people that have been arrested, we really believe they will sing, and this will assist us to deal with this aspect. It's just unfortunate that the number of schools burglaries have now jumped from 18 to 40 in the last 48 hours. We now have 40 schools that attacked by those that we don't know why they're attacking our schools. In conclusion, we also want to thank institutions that continue to provide academic support outside government. There are institutions that on their own, it can be former educators, it can be NGOs, or it can be bodies that have material that assist in education. Those institutions have continued to offer education, and we want to thank those institutions. Thank you so much. Thanks, man.
All right. Okay.
Essentially, the concluding question that has been asked, which we are not able to deal with now, is what happens after the 16th. That question can only be answered at a national level. I know that the president is continuously consulting with the premiers, and the Minister of COCTA regularly consulting with the mayors. The assessment of where we are is something that will inform the decision that will be made by the National Command Council and communicated by the President. I think all I can say to you is that it will be a profound mistake to think that these numbers where we are now represents where we might be. It is important, the message that the Minister of Health sent out, that this may just be the calm before the storm, is the best way to deal with this situation. We think we should really, really prepare for the situation that might go way above where we are now. And we have to be ready for that. Our province is the epicenter. We know that once you open the airport, once you open the borders, you're creating big pressure for us to be able to deal with this situation. But there will also be other assessments that will be made, what the impact on our people will be at each given moment, assessing what the gains are, the gains in terms of keeping the infections much lower and curbing the spread and flattening the curve, and the impact around the well-being of people. So I'm confident, I've absolute confidence, as I've said, in our president. When we look at other nations, what they are going through, as South Africans, we should be happy that we have a president who is proactive, who also consults, who takes the best interest of our nation at heart and leave out all the other political things. Even in this province, I must thank all the political parties that are represented in our legislature. Yesterday we did the last briefing session with them. All of them are working with us. They are working with the government, the religious sector, the faith-based organizations, the NGOs, the foundations. All of them are working with us. So far in South Africa is good because COVID-19 is not being politicized. All of us are confronting it as an existential crisis, as something that threatens the survival of humanity, and that all of us must face up to it. That's what we are happy about. So when that time comes to assess where things are, I'm confident that the leadership of our nation will make the correct decisions that are in the best interest of the country, and we as a province will make an input in there, in that decision-making process. I want to continue to warn, we must not be complacent. We must enforce the rules as they are now. It is not time to think that we have overcome, especially because we are getting into winter. We are all very vulnerable. But we will be guided by our president. And we are confident he'll make, together with our national cabinet, the best decisions will be made for this country. So far, so good. We have good leadership. We don't have nightmares about the leadership of our nation. We have good leadership. Thank you very much.
Okay, thank you, Premier and MECs. This brings us to the end.